It's been really tough for people with seasonal allergies.
That's for sure. And here with some soothing advice is Dr. Shadi Kourosh, Director of Dermatology for the Community Health Program at Mass General Hospital. Dr. Kourosh, thank you so much for joining us.
Great to be here. Good morning.
Good morning. Okay, first there's tree pollen, then there's grass pollen, and can we get a break after that? That goes to ragweed. We know any one of those can cause sneezing and watery eyes. What about the impact to our skin?
Yes, that's a great question. These allergens, which are tiny particles that cause allergies and irritations, can become airborne. So they could be hitting our airways, we could be breathing them in, and they could also hit our eyes and our skin, causing irritation.
So as you know, a lot of people, including children, have issues with eczema. Why do seasonal allergies tend to make that worse?
So there's a relationship between our skin and our immune system. And a lot of people that have eczema also have sensitivities in their airways. So they could be breathing in these allergens, which could make their immune system more sensitive and their skin more sensitive. And also these allergens could be directly hitting our skin, causing sensitivities. So it's important to be mindful of that and also to try to avoid situations where allergens could be hitting our skin. So during this time, a lot of people may find it could be helpful to keep the windows of their homes or car doors closed, and also to be a little bit mindful of the sensitivity of their skin by only using fragrance-free hypoallergenic products and sunscreens that are mineral-based, containing zinc or titanium rather than chemicals. And then also they may find it helpful to manage with over-the-counter cortisone creams for their skin, antihistamines. People with asthma might be using their inhalers a little bit more often. But if that hasn't helped after a couple of weeks, it might be helpful to see a dermatologist and figure out if there's an allergen that they may not know about that could be affecting them.
Yeah, if you're headed out to buy some products, it's easy to spend a ton of money on skincare. Can you suggest a few inexpensive products that may offer some relief, especially for the dry skin around the eyes and the nose?
So I teach my patients to read ingredient labels rather than to look at brand names. So I always encourage them to flip that bottle over and look for things that, for example, for sunscreens that contain zinc or titanium rather than those big long chemical names. And then to look for labels that say fragrance-free and hypoallergenic, because certainly there's a lot of labeling these days that can be confusing. Some labels are meaningful and some are actually meaningless, but usually if things say fragrance-free and hypoallergenic, that's a good start. And then I encourage them to bring their products in and actually talk with their dermatologist about it. And in situations where they may not be getting better after a few weeks, to consider allergy testing. And I have wonderful colleagues who I work with here at the hospital where we've helped certain patients figure out certain products that they may personally be allergic to.
Some very good advice in there. Dr. Kourosh, thank you so much for joining us this morning.